Namaskar dosto, welcome to channel Toxicology on board. Today in this video we'll be discussing about another important topic, that is scorbutic poisoning and histamine-like syndrome. So these questions are taken from ABT recertification question paper year 2000, and same on the same concept like poisoning. No, in year 2022 DABT main exam will be there. No, in that also they have asked. This is given by the based on the memory of the students who appeared for the exam in year 2022 DABT exam. So we'll try to learn about the concept with respect to scorbutic poisoning. So we have first question is, scorbutic poisoning is anaphylactic reaction. Option 2 is effectively treated with antihistamines. Option 3 is commonly caused by ingesting spoiled tuna. Option 4 is an allergy to fish. The right answer will be in the green text, that is option 1, option 2, and option 3. That is, scorbutic poisoning is an anaphylactic reaction, means it is immune mediated related. See, when it comes to anaphylactic reaction, you have to remember four types: IgG, okay, four types will be there. That you have to remember, where immune complex mediated will be involved. Okay, then effectively treated with antihistamines. Since scorbutic poisoning, no, another name for scorbutic poisoning, the symptoms with respect to scorbutic poisoning are similar to that of the histamine. Okay, we'll understand the mechanism also, then you will understand why it is also called as histamine-like poisoning. So, by using antihistamines, we can treat that particular type of scorbutic or histamine-like symptoms. Coming to third option, that is commonly caused by ingesting spoiled tuna. So there are different types of fishes will be there. Like you can see, this scorbutic poisoning, it is caused by consuming contaminated fish in which the histamine levels are more. So what type of fishes means tuna, mahi, bluefish, mackerel, sardine, marlin, bonito, shad, and herring. These are the different fishes, consumption of these fishes which are having high concentrations of histamine, then you will be getting this kind of scorbutic poisoning. Okay, so in the textbook also they have listed this type of fishes. So in the exam, in the options also, if you come across this mahi tuna, for example, here it is given by ingesting spoiled tuna. If you know the list of fishes which are responsible for causing scorbutic poisoning, you will be able to answer in the exam. Okay, and concept that you have to remember is that fish is there, fish is getting contaminated, in which histidine is there. Histidine, which is present in the fish tissue, it will slowly get converted into histamine. So whenever the histamine level are high in this particular contaminated fish tissue, and that fish which we are consuming, then it is causing this histamine like syndrome. Okay, so it is caused by eating poisonous fish, heat stable toxin. So once the whatever this histidine or histamine which is there in the fish tissue, no, even if you heat the fish, still it is heat stable. Okay, there are a lot of foods, upon heating up to 100 degrees centigrade or certain temperature, the bacteria or whatever the toxins will be killed, they will be degraded. But in this case, this is an exception, where even upon heating, this the particular thing histidine is there, no, it is heat stable toxin. Histidine toxin broken down to histamine, as we can see this pathway you have to remember. Okay, so what are the important symptoms that we can see with respect to scorbutic poisoning, which is similar to that of histamine, is it causes skin flushing, throbbing headache, abdominal cramps, oral burning, nausea, diarrhea, palpitations. Okay, and symptoms will occur within 10 to 30 minutes of consuming this particular contaminated fish. So with respect to textbook, we'll see what are the things that we can learn. Okay, so we are referring to Clayson 9th edition, chapter 27. It comes under food toxicology. Okay, so first important concepts with respect to scorbutic toxicity we'll be reading. Scorbutic toxicity causes scorbutic fish poisoning. Okay, this is the in the exam also. If in the question you come across this terminology, you have to remember scorbutic poisoning is unique among the seafood toxins because it results from product mishandling. Because whenever you catch that particular fish, if you're not storing the fish at a particular temperature, because of the mishandling of the or storage of this fish, product mishandling rather than contamination from the other trophic levels. Means whenever the fish was there in the biotic chain, food chain, it didn't cause any contamination. But because of the improper handling and storage of the fish, the histidine was converted into histamine. Histamine levels in that particular fish tissue increased. Okay, so now we understood the problem. So now, if we in the first step itself, if we are able to store the fish in a proper refrigerated condition at certain temperature, then we can avoid this type of contamination. Third point, scombite toxicity is most commonly caused by consumption of fish. It belongs to the family Scromboidae family with high histamine levels such as tuna, mackerel, bluefish, sardines, anchovies, and mahi-pai. So here I have given the list of fishes you can see. It is there given in the textbook also. And certain times you will see in the options also. And symptoms are similar to that of the histamine toxicity. And such histamine induced reactions are often misdiagnosed as IgE mediated fish allergy. Since the symptoms are similar to that of histamine, and most of the symptoms which were visually appearable are what redness, skin flushing, palpitation. This type of you can see with other immune mediated complex reactions also you will see like IgE, IgM, IgG. Okay, then you will not be able to identify the difference or what is the actual cause for that symptoms in that particular patient. It is much more challenging for the physician. Okay, if the fish with high levels of tissue histidine are not refrigerated properly. This is a key word. You have to refrigerate at certain temperature. The bacteria proliferate. So if there is a bacteria within the fish tissue or gut, whatever you say, it will convert this histidine into histamine. Bacteria proliferate means it will rapidly multiply, increase its number, convert the tissue histidine into histamine, which is heat stable. So once this histamine or histidine, whatever is there, it is heat stable. Even upon eating the fish tissue at a high temperature, you are unable to degrade this particular toxin. In most cases, histamine levels in the illness causing fish have been above 200 ppm, often about 500 ppm. So, what is the important thing with respect to these levels? 200 ppm, 500 ppm is these levels are established by the regulatory toxicologist. So, even in the case of Ciguatera for fish poisoning, also you have seen, I have upload, I will give the link in the description. So, these limits because you cannot make completely zero, so there will be certain residues still will be there. So these limits at what above certain ppm it is causing toxicity, these limits are established by toxicologist, regulatory or risk assessment toxicologist. So here in this case it is 200 ppm and often above 500 ppm. Okay, symptoms of toxicity, so these are similarly like that of the histamine related, that is tingling, burning sensation around the mouth, headache, facial flushing, palpitation, profuse sweating, truncal rash. Means in the picture you have seen, no, complete red color rashes are there, pruritus, abdominal cramps, nausea, and diarrhea. In most people, these symptoms are self-limiting. Like they once it will get recovered. Okay, but circulatory collapse, shock, acute pulmonary edema means if there is a fill of fluid in the lungs or difficulty in the breathing and have been described as severe cases. So, sorbite poisoning is most common cause of ichthyotoxicosis worldwide. So, try to learn about this particular terminology. What is this ichthyotoxicosis? Here you can pause the video and read any kind of poisoning which is caused by toxins which are associated with fish, which can occur through ingestion of contaminated fish meat. Here different types of thing will be there. Under ichthyotoxicosis is a bigger umbrella under which you will get pufferfish poisoning, you will get Ciguatera poisoning, you will get this one scombite poisoning. So all type of fish poisonings will come under bigger umbrella, that is ichthyotoxicosis. Okay, or through direct venomous injections, that is if there is a venomous fish is there and because of which also those type of poisoning will also comes under ichthyotoxicosis. So pause here, try to read about this particular definition. Because more than 80% of the fish consumed in the United States is now imported from other countries, the disease is intimately linked with the global fish trade. With the advancement in the global trade, no, now we are able to consume in the US also. You are able to consume the fish from the Chinese waters or from the Indian Ocean or from the Japan, like that. So there, because these fishes are also, no, you have to understand, post World War II also most of this fish meat it is stored in the cans. Okay, and in that also there is poisoning will be there, food can this thing. Okay, so there are two more questions were there which were from year 2009 from the ABT recertification question paper only. So with respect to this concept, this topic only, so what was the question? This question is very direct. If you know the concept, you will be able to answer this question. The question was, a histamine-like syndrome is produced by. So they have given different types of this thing. Tetrodotoxin. Option B, we have scorbutic poisoning. Option C, we have Ciguatera poisoning. Option D is A and B. Option E is B and C. The right answer will be scorbutic poisoning. So one of the synonyms or one of the another name, it is called histamine-like poisoning, scorbutic poisoning. Tetrodotoxin is caused because of the puffer fish, and Ciguatera poisoning is caused by, there are different Ciguatera family of fishes are there. One, I will give you the description in the link. Uh, I will give the link in the description where you can go about this particular topic in detail, and 15 to 20 minutes video will be there. Okay. Then another question was, scromboid poisoning has occurred after the ingestion of. So once you know the different types of fishes here, we have here in the options we have mackerel, we have mahi mahi, sardines. So try to remember that picture which I have shared. So if you remember that one, and in the textbook also they have listed these are the fishes. Anchois is not given here, but anchois is also is causing scromboid fishes. So the answer will be in the green text. Mackerel, mahi mahi, and sardines are the one which are causing scromboid poisoning. So pause here, read this diagram also, because most of the points are repetitive. Only thing I'll discuss is how to prevent this type is proper refrigeration of the fish upon first catch in sea until freezer, that is 4 degrees centigrade. That is what I was saying. Storage, because in the first step itself we are being very careful. Prevention is much better than cure. Okay, contamination fish may taste peppery, sharp, and salty. Some may look and taste normal. So you are unable to, until unless you consume, you are unable to identify whether that particular fish tissue is poisoned or not. Okay, pause here and read all these 5 questions, and remember with respect to exam. So we will see important some other points which are discussed under this textbook only, under food toxicology. Very quickly, chromboid for food poisoning is a foodborne illness, results from eating spoiled fish, that is decayed fish. You have to remember. Second most type of seafood poisoning, second only to Ciguatera. Okay, this is also important. As I told you, read about Ciguatera poisoning, pufferfish poisoning, as well as chromboid poisoning. It is often missed because it resembles similar to that of the allergic reaction. Most commonly reported with so and so this list. And in this, anchois is missing. Remember about anchois also. And related species of fish that were inadequately refrigerated or preserved after being caught. Scromboid can result from inappropriate handling of fish during storage and processing. One of the most toxic agents implicated in scromboid fish poisoning is chemical called histamine. So one of the options you will get that also. Other chemicals have been found in decaying fish flesh, but this association to scromboid fish poisoning has not been clearly established. So under food toxicology, please read this chapter. If possible, make a table with different types of fishes and what are the important toxins which are released, and how can you prevent it? What are the important symptoms? With respect to symptoms also, you'll get a question in the exam. So another thing I would like to request you, as I told you, please read these topics along with this and integrate and try to remember it. Thank you so much. Be curious. For any questions, you can always write email to arya.priyanka18@gmail.com. All the best for your exam.